Since the onset of the pandemic, doctors are seeing more patients living with a nervous system disorder. That includes Piedmont Macon. Our morning reporter Farihar Bar met one doctor and his patient who are sharing the symptoms to look out for and what you can do to treat POTS. Farihar, what exactly is POTS?
Well, POTS is short for postural orthostatic tachycardia syndrome, which tends to make people lightheaded and dizzy. Right now, it affects about 1 in 500 Americans, according to the National Institute of Health. And as you heard, there's been a rise in diagnoses since the COVID-19 pandemic. But there is hope for treatment and research, according to one doctor at Piedmont Macon. Callie McAlvin's Apple Watch rests on her left wrist every day.
That's actually what helped me get diagnosed.
Since the 6th grade, she's felt like something's off in her heart.
It was when I was playing soccer, actually. I've always had like a really fast heart rate, and that, like I said, it was mistaken for anxiety. And then one day I went to the doctor and one nurse was like, "Something's wrong." I was like, "Yeah, I know." And that's when I got referred to the cardiologist.
Unaware of her circumstances,
I felt like I was trapped and I didn't know what to do.
It's usually a positional change. You know, I tell people, look, if you feel lightheaded, if you're one of the lucky ones that's given a warning, like you see spots in front of your eyes, you're about to pass out, lay down.
Dr. Carmine Otis is an electrophysiologist at Piedmont Macon. He's seen patients living with POTS his entire career.
I have patients in every age range now. It's pretty astounding. And it's mostly looks like it's related to COVID a lot of the time.
Since the pandemic, he's treated a lot more.
Palpitations, that's a big deal for us. We're looking for abnormal rhythms that can cause stroke, rhythms that can cause heart failure, rhythms that can cause sudden cardiac death.
But there's a lot more research being done these days to help patients living with the syndrome.
Eat a lot of salt, that helps a lot. I'll get like a Gatorade or something because it has a lot of electrolytes in it. But I keep packets of salt in my desk.
Dr. Otis explains he uses a, quote, 3-pronged attack.
Dietary therapy, I usually tell my patients salt and water are your best friends.
Thankfully, I'm a big fan of salt.
Lifestyle changes, gently start exercise and ramp up, and that helps. But that's, again, not the be-all, end-all. Then you transition to medications.
But the electrophysiologist says it takes a team to get the patient any type of treatment.
Primary care guys, honestly, you got to give the hats off to them. They're putting 2 and 2 together, and they're really picking up on a lot of stuff. Running through all the labs that you're supposed to get and try and figure out what's going on. There actually leaves me very little to do other than maybe the tilt table test.
That's all it took was one person believing me, but I had to really advocate for myself.
Now McAlvin's sharing the lesson she learned.
I would just say don't give up on yourself if you feel like something's wrong. Listen to your body. Always advocate for yourself. All it takes is one person believing in you.
Like you heard, if you feel like you're living with any of the symptoms, the first thing you should do is lie down, catch your breath, and snack on something salty and drink something with electrolytes like Gatorade. Then contact your doctor. Frederick?
All good.